of the Mental Health Asian Clinic. And also he is the founder of Hong Fook. Please join me in welcoming Dr. Low.
Thank you, Maria. Today, thank you for the introduction for today's event, because COVID-19 has brought on multiple challenges on all of our lives. Well, not all of us would catch the virus, but all of us are experiencing challenges on our mental health. Beyond the fear of the virus, we all have stress dealing with the current situation, and also maybe that may lead to anxiety, depression, and also insomnia, which we'll touch upon. So these are symptoms that are suffered by our patients actually every day before the onslaught of this pandemic. But now it is shared by all of us in varying degrees. For many of us, this is an awful experience, but now we are all in this together. And only by supporting one another can we get through this. Our psychiatrists have been helping people through similar challenges in their individual lives, and I believe the talk will present you with ideas to help you cope with the current situation. So let us all learn through this ordeal to thrive together and to become better individuals and together a better society. This event aims at supporting the mental health in our Asian community in two ways. One way would be to offer these psychiatrists' wisdom to share with you so that everyone can benefit in our community. But the other is actually to elicit donation to support our work at Hong Fook. And I want to thank our champion sponsor, Vogler Rubinov, and all the elite and community sponsors. My co-chair, Mr. John Shamilian, can't make it today. So on his behalf, he wants me, I want to help him express his wish to make this a success. He has been helping Hong Fook's fundraising activities because he believes in Hong Fook's work in advancing the mental health of our communities, not just the Asian community, but beyond to the larger society. So we need your support to continue this critical work. To make a donation, you can go to www.hongfook.ca to donate online, or you can just text 20222 and text Hong Fook's name and then donate the assigned amount. Thank you very much, and I hope you enjoy the webinar.
Sorry about that. Thank you so much, Dr. Low, for your great introduction. And now it is a great pleasure. I would like to present to you our first speaker, Dr. Michael Mack. And Dr. Michael Mack, now currently, he is working with Center for Addiction and Mental Health, as well as Hong Fook Mental Health Asian Clinic. And also, he is the assistant professor of psychiatry at University of Toronto. And also, he is the adjunct research professor at Western University. So today, Dr. Mack is going to talk about sleeping well through COVID-19. I'm sure this is a very timely and much needed topic. So please join me in welcoming Dr. Mack.
Everyone. So today we're going to talk about the topic of sleep. And as you know, we spend 1/3 of our lives sleeping. So it's a very important thing, even outside of COVID, but especially more so now that we're dealing with this crisis. The objectives today, we're going to talk about why sleep is important to our health, important to our mental health. And if there is a problem with sleep, we're going to have to know what the problem is and how to define it. So we'll be talking about the assessment and categorization of insomnia, which is probably the most common sleep disorder that's out there now. And lastly, knowing what the problem is, we're going to look into the gold standard solution, the best treatment for problems falling asleep and staying asleep, which is something called cognitive behavioral therapy for insomnia. So why is sleep so important, especially during COVID-19 times? I'm sure we all have ideas. Well, for one, a lot of social connections are being broken right now. You know, not just for regular folks, but especially our clients, folks involved with Hong Fook, who come into our clinic, into our various programs, and have that social interaction that's crucial for mental health. You know, staying away from each other is a very difficult thing, especially when you think about families. You know, some young folks are not seeing their parents for months on end at a time. My father, who's 80 years old, I haven't had a chance to see him in person since February of this year. So, you know, this can exact a detrimental effect on all of our mental health. So not only are we losing the social contact, but we're also losing a lot of the avenues for continued good mental health, such as exercise, going to events, going to shows, things that make us happy, we're not able to access right now. And, you know, as we speak, restaurants are still not open. Based on studies of previous crisis events, including SARS, we know that there can be a significantly higher level of depression in terms of incidence, new cases of depression during these types of times. There's a worsened level of anxiety, and that can be amplified by economic worries, you know, knowing that so many businesses are negatively impacted by social restriction. Many folks are worried about losing their jobs. And of course, a more pragmatic, practical kind of worry, the worry of infection. The increased isolation makes us all less happy. Being that a lot of folks are now working from home or staying home, there's a lack of a structure or a lack of a daytime schedule. A lot of the patients that we see at Hong Fook are involved in many intensive therapy groups, intensive interactions with our service, and not being able to go in person sometimes causes them to have lack of a daily schedule, which interrupts sleep, which makes sleep worse. Because if you don't have a set wake time or sleep time or something to go to the next day, some folks may tend to sleep less and some folks may tend to sleep more. And that can actually impact not just mental health, but also physical health. Due to the physical distancing rules, many folks are not going outside. And by not going outside and staying in their apartments or homes, there's less exposure to light. And we're going to touch on the reasons why light exposure can be very important to sleep health. And lastly, I've heard from a lot of patients that, you know, to pass time, they've been using things like Netflix and YouTube and watching television programs, and that can impact nighttime sleep. And we'll touch on all the reasons why these things can make sleep a bit worse. As a matter of fact, interrupted sleep leads to poorer immune response, leading to higher rates of infection from various illnesses. We absolutely know that interrupted sleep increases new cases of psychiatric illness and makes existing cases worse, and overall leads to poor cognitive performance. So problems remembering things, problems performing, problems going to work, going to school, things are very important to us. So today I wanted to talk about insomnia, which is the most common sleep problem that's probably out there at any given moment. If you think about, you know, a nighttime symptom, so a problem falling asleep or staying asleep or waking up too early, that can be upwards of 30 to 48% of the total population. And if you consider insomnia, you know, it doesn't always happen by itself. Frequently, it occurs with both medical and psychiatric illness. And if you have a medical and psychiatric illness to begin with, then you're much more likely to have insomnia. Generally speaking, no matter how it starts, you know, what causes it, if it's a person getting sick, if a person moved to, you know, a new city or new country, if a person got a new job, whatever cause led to a person having problems falling asleep or staying asleep or waking up too early, if it becomes entrenched, meaning that they have the symptoms for more than a month or two, it tends to follow them. And we know that it exerts a significant healthcare and occupational sequelae. A researcher in the University of Montreal, Charles Morin, found that in terms of direct and indirect costs to society from insomnia, amounts up to $3.6 billion a year in Quebec. So when a person's not sleeping well, they're not going to perform as well at work. They're not going to perform as well at school. They're going to have to see their doctors more often. They're going to have to pay out of pocket for sleeping medications possibly and get other forms of medical care. So there's a big cost to insomnia to society. We as psychiatrists have a diagnostic Bible, and in terms of how we define insomnia as a disorder, well, this slide talks about the nighttime symptoms. So as I mentioned before, insomnia means that the person has either a problem falling asleep, staying asleep, or waking up too early. Now, if a person has those symptoms, but they're still able to go to work and go to school and do well in life, then we can't call that a problem. So the second criteria just tells us, okay, the nighttime symptoms have to cause a next day daytime symptom, a problem with functioning. And the next two criteria talk about duration. So, if a person has problems falling asleep, staying asleep, or waking up too early, maybe one night out of every 6 weeks, we wouldn't say that that's a problem. It has to happen frequently enough to cause issues. So we like to think that insomnia is a problem when it occurs at least 3 times a week and is present for at least 3 months. So I touched on this a little bit earlier. This is just some statistics in terms of how frequently insomnia is found in society. If you're talking about nighttime symptoms, a problem falling asleep or staying asleep or waking up too early, well, that's about 1/3 of all folks at any given moment. In addition to that nighttime symptom, we add that criteria of daytime impairment. So, not only are you having nighttime symptoms, you're now having problems at work, you're having problems at school, you're having problems with family and friends, then that's about 1 in 10 folks in society. If we add duration criteria to this, meaning, the person's got to have it for 3 times a week for 1 month at a time, well, then that's going to be 6%. So this is a big problem out there, and many folks have it. So insomnia tends to run with psychiatric illness, and many of our psychiatric illnesses, including major depressive disorder and generalized anxiety disorder and post-traumatic stress disorder, all have descriptions of problems with sleep as part of their definition. And when we think about, what's the proportion of time that, people have psychiatric illness when they do have insomnia, it's much more elevated than when compared to the general population, meaning that if you have insomnia, you're more likely to have depression and anxiety. So the 12-month prevalence of depression in Canada is anywhere between 4 to 6%, and anxiety is 10 to 12%. And as you can see from these numbers here, that if you do have insomnia, you're much more likely to have both depression or anxiety. Insomnia is not just associated with mental illness, it also is associated with many medical illnesses. And in fact, it's hard to find a medical illness that doesn't predict a higher co-occurrence with insomnia. So as you can see here, heart disease, cancer, high blood pressure, neurologic disease, breathing issues, urinary issues, diabetes, chronic pain, and gastrointestinal problems, and any medical problem for that matter, predicts a much higher likelihood of that person having insomnia as well. So what this slide is telling you is that if you have one of these medical problems, you're much more likely to get insomnia. Society as a whole, historically has in terms of total sleep time, has decreased significantly. In large scale population-based studies where they send questionnaires to, people who are on the census for voting. They found that in the 1960s, people were sleeping a lot more than they did today. So, one study showed that folks were sleeping between 8 to 8.9 hours in 1960. And then a similar study done much later in 1995 showed that people are only sleeping 7 hours now. And the most recent data shows that 30% of all folks sleep 6 hours or less. And in the same period, we saw a large rise in type 2 diabetes and obesity. And that's where the idea came to us to look into connection between poor sleep, shorter sleep, and things and problems with your metabolism, things like obesity and type 2 diabetes. When we study folks who sleep a short duration, less than 7 hours, or describe having a poor sleep quality, even when we control for their weights and controlling for the presence of sleep apnea, we know that those folks tend to be heavier. So we think that when you sleep less, there's a tendency to gain weight. And we see this in folks that work, changing shifts, night shifts, people that have to do daytime and nighttime and overnight shifts. So people like, that work at Canada Post, nurses, and a variety of other occupations. So just more studies that show that sleeping less leads to central obesity, and central obesity is an important thing. This study looked at females. What they found was a person that slept a less amount of time, generally less than 7 hours in length, they had more weight gain in the abdominal area. And we know that that's a big problem because obesity in the abdominal area, fat in the abdominal area, is associated with a higher risk of things like high blood pressure, type 2 diabetes, heart attack, and stroke. And when we look at specific hormones in folks who are deprived of sleep, I want to draw your attention to leptin and ghrelin, which are the two bars on the left side. Leptin is the hormone that our body releases to tell us that we're full, that we're satiated. And ghrelin is the hormone that tells your body that you need to eat more, you should be hungry. So when people sleep less, for whatever reason, they tend to have less of the hormone that tells them to eat less and more of the hormone that tells them to eat more. So this sort of underpins our understanding of why low sleep leads to cardiac issues and cardiovascular issues. And as you can see from the other bars, deprived sleep leads to increased hunger, increased appetite, a craving for carbohydrates, and even other foods. So I mentioned that, when we first looked at this issue, the connection of curtailed sleep, low amounts of sleep, short duration sleep, and increased obesity, studies were made to extend this, to look into other specific conditions. So type 2 diabetes, what they found was folks that slept less than 5 to 6 hours a night, there was a much higher risk of things like type 2 diabetes, which is becoming more and more common all over the world. In North America, the rates of diabetes were increased even in the late 80s and 90s, and they're quite high right now. And looking across the world, in China and the East Asian countries, we see a similar rise in the incidence of type 2 diabetes, especially as diets change. So I want to talk about some tips on how to get better sleep, not just during COVID, but also beyond. So first off, before we know how to deal with an issue, we need to see, what are the patterns of your sleep. So these are just two different types of sleep diaries, and you don't have to follow these on your own. I mean, if you just keep a log that measures, when you went to bed, how long did it take for you to fall asleep once you turned the lights off, how many times you woke up in the middle of the night, and how long the middle of the night awakenings lasted, when you woke up in the morning and got out of bed, and just a rating of the quality of your sleep, that will do, and they'll be very helpful for your doctors to help you with your sleep. So I'm just putting on the screen here some common sleep diaries. If you keep track of your sleep and you write it on a sheet of paper, we call it a sleep diary. On the left-hand side is a free one from the American Academy of Sleep Medicine, and it's more pictorial. we ask patients to fill in the blocks when they're asleep and, mark down when they take medications or drink caffeine or exercise. And this helps you, the patient, or, your clinicians to help you with your sleep. Now, these days, it's hard pressed not to find somebody with, a smart watch or smart device or a steps tracker. And these devices are actually very accurate in determining when a person fell asleep and when they wake up. What they do is they use movement as a proxy for wakefulness, and no movement or little movement as a proxy for sleeping. So on the right-hand side, these are just the outputs that we get from, these activity trackers. Things like, your Apple iWatch would do the same thing. Fitbits, they all output similar data. And what you see on the graph on the right-hand side is, if there's a large, tall, black vertical bar, that means the person is moving. And we know that when people are moving, generally speaking, they are awake. And when they're moving less, that might be the time when they're sleeping. So the parts where we think this person is sleeping are highlighted in blue. So this is a nice way for patients and clients to track their sleep without having to write things down, especially if they have a smart device. And what's good about this for the patient is that they can always look on their smartphones or their computers and see, from day to day, are there patterns when I'm sleeping less? Are there days when I'm sleeping more? And what am I doing that day? So you can connect your levels of activity with, how long you slept and how you felt when you woke up. So I want to touch on some tips in terms of how to help your sleep. Sleep is one of those funny things. For a lot of folks, the harder they try at it, the worse it gets. And they spend a lot of time, thinking about sleep. And as we all know, ruminating about it doesn't help. In fact, probably it makes it a bit worse. So throughout the years, people have been looking into different ways to treat problems falling asleep and staying asleep and waking up too early. And, in the 50s and 60s, most of those, the only treatments at those times were medications. And as we now know, medications aren't necessarily the best choice, because all medications come with good and come with bad. And the downside to a lot of these sleep medications is that, for some people that take them, when they wake up the next day, they feel groggy, they feel sleepy. They're not at their very best in terms of daytime performance. So, trying to solve that nighttime insomnia paradoxically causes the next day functional impairments. So medications, that's where we start seeing problem side effects. So in addition to that side effect, we now know, studying all the different types of sleeping medications since their inception, even to the ones that are released now, a lot of them, if a person wakes up in the middle of the night, they have a much higher chance of falling, because, sleeping medications want to keep you asleep. So you're going to feel sedated or tired, and your balance might not be perfect. And in folks 65 and above, so elderly folks, we actually have measured a higher rate of falls leading to hip fractures. And that's why a lot of sleeping medications are not recommended for older folks. And, as society grays and, there's a bigger and bigger proportion of people that live longer, and thus there's more people who are 65 and above. We have to keep these things in mind. And lastly, we know that sleeping medications can cause a person to drive poorly. Looking at people who take sleeping pills, we know that they have a tendency to swerve off the middle ground. They can't keep a straight line compared to people that don't take sleeping medications. And unfortunately, some sleeping medications can lead a person to their bodies get used to them, and they have to take more and more of the dose for it to work. And sometimes it takes a long time, and it's a very tough time to stop sleeping medications. So psychologists and psychiatrists came together and thought, how do we solve this? How do we treat sleep in a way that doesn't require medications, that works for everybody? And they came up with something called cognitive behavioral therapy for insomnia. So cognitive behavioral therapy for insomnia is the gold standard treatment for insomnia, meaning it's the best treatment. There's no treatment that is as good as CBT-I. So this therapy is a short-term therapy, and classically speaking, lasts 6 to 8 sessions. And you know, it basically it teaches you how to change your approach to sleep. You know, what are your beliefs about sleep that need maybe some challenging? You know, instead of sleeping more, maybe you should sleep less. So here's where I'm going to talk about this. Okay, so I'm going to talk to you about some of these, you know, the major tips that can help your sleep during these COVID times. And because these are just, it's a course, it's just, you know, some directions that you can take. It's free and everybody can do them. And in fact, if you hear them and it makes sense to you, you can try these tips out tonight to improve your sleep. So, you know, the best part of all is that because it's a therapy and it's a course, there's no side effects. You know, the only thing you have to give is your time and dedication. So I'll just start off by talking about sleep restriction, which is what you see before you on this slide. So for a lot of folks that have problems falling asleep, you know, they make it a game to, you know, spend more time in bed. But the problem with sleep is that it's subject to conditioning. So some of you folks may remember Pavlov's dog. This is like a famous experiment by Pavlov, where, you know, every time he fed his dog, he would ring a bell. And then afterwards, you know, after doing that for several weeks, he didn't give the dog food, but he rang the bell. But every time he did that, the dog, associating the bell with food, would salivate in preparation for a meal. So sleep is subject to conditioning. And if you end up spending a lot of time lying in bed, not asleep, which is the problem with insomniacs, people that can't fall asleep or stay asleep or wake up too early, then you're going to condition yourself in your brain to think that, okay, well, it's okay for me to sleep in bed, lie in bed without sleeping. And that makes it harder to get better. So one of the strongest ways to improve your nighttime sleep, to make more of your time lying in bed into actual sleep, is something called sleep restriction. Okay, so that's what you see on the slide right here. The first line talks about restricting time in bed to pre-existing total sleep time. So what does that mean? Well, if a person is lying in bed for 8 hours, you know, because let's say, you know, Mr. Wong, you know, he's always slept between midnight to 8 a.m. and then he has to get ready and go to work by 9. But now for the last 6 months, it's taking him 2 hours to fall asleep. Well, then what we know is this. We know that he's actually spending 6 hours in bed actually sleeping, but 2 hours awake. So what we do is we ask Mr. Wong, well, what you're going to do is you're going to make your bedtime 2 a.m. And I know that that doesn't sound right to you. It doesn't sound right on first glance, but I'm not actually telling Mr. Wong to sleep any less than he already does, right? Because he's lying in bed for 8. He's only sleeping for 6 because it takes him 2 hours to fall asleep. I'm just telling him not to be in bed for the amount of time that he's not sleeping. And that has 2 effects. The first effect is it decreases the conditioning of Mr. Wong's mind that it's okay for me to lie in bed while being wide awake, right? Because there's that 2 hour period when he's trying to fall asleep at the beginning of the night is no longer there. He's going to be not in bed. He's going to be in a different room, a dimly lit room, you know, doing something boring. The second thing that this does is it increases the physiologic need to sleep, okay? And what I mean by that is, I think it makes sense to all of us that the longer we stay awake, the longer that we're not sleeping, the sleepier we become. So for young folks, what I tell them is, you know, do you remember that time when you had to stay up all night to do a homework project or to study for an exam? And how did you feel after exam? Well, you know, the answer is I feel exhausted. And, you know, and if I had to stay up for 24 hours before an exam, I feel much more sleepier than I did when I stayed up for 20 hours. So the longer time you're awake, the bigger the pressure your brain and your body will want you to sleep. So we're adding 2 things here. We're taking away the conditioning of lying in bed, not sleeping, but we're also making you feel more sleepy because you're awake longer. And after each session, what we do is, well, you know, if Mr. Wong is now sleeping at 2 a.m. and waking up at 8 every day for a week, the next time I see this person, you know, if Mr. Wong is falling asleep right away at 2 a.m., then I say, okay, well, why don't we try you, you know, going to bed at maybe 1:45? So we can make adjustments in terms of when the person goes to bed at the beginning of the night, and you know, expand that window until we can get the person sleeping as much as they can without, you know, having a significant amount of time lying wide awake. Stimulus control is the other very important principle of cognitive behavioral therapy for insomnia. So, you know, what this does is it reduces all the factors that make a person more awake. So, you know, sleep cuts both ways. You don't want to be too alert, and you want to be more sleepy. So this stimulus control reduces all the factors that make you feel more awake, okay? And these are the general rules, and these are rules that I think anybody that's watching right now can try and do. You should only go to bed when sleepy. You know, there should never be a set sleep time. And the reason for that is, if you think about it, it might make a little bit of sense, is that depending on what you did during the daytime, you know, some things can make you feel sleepy earlier rather than later. So, you know, a person that's gone to the gym and you know, ran for 2 hours, or a person that, you know, left their home and wore, you know, their surgical mask or their facial covering, and they've taken a long walk, their bodies, because there's more exertion, they're going to want to have that rest, right, to rebuild muscles and bones and things like that. And therefore, you know, when you feel sleepy during the day, it's going to vary from day to day. So, you know, think of all the times when you had to, you know, give 2 or 3 presentations, or, you know, all the times when you've had to work a long day, you're going to feel sleepy earlier. So you never want to set the same sleep time from day to day, because it's a recipe for insomnia. Okay. So imagine Mr. Wong tells himself, well, I have to sleep at midnight every single day of the week. Well, you know, on the nights where he's working harder or going out to exercise more, maybe he's going to want to sleep a little bit earlier, you know, maybe at 11 p.m., maybe at 11:30, who knows? And then on the nights, you know, when he's not doing very much during the daytime and not as physically active, well, he might want to sleep later naturally, right? So keeping a set sleep time is disastrous, because on all the nights where you don't feel like sleeping at midnight, you're just forcing yourself to stay awake. And as I just mentioned, you know, the more nights that you have when you're wide awake lying in bed, well, that predicts for worse nights in the future because of conditioning. So if a person, number 2 here, talks about, you know, getting out of bed when, you know, you're not able to sleep, and go to a different room and come back when sleepy again. So this also takes away that association between wakefulness and your bedroom. So, you know, our brains are very, very smart. They're able to tell, okay, am I in my natural sleeping quarters? Am I in my natural sleeping environment? And you want to do everything you can to reduce, you know, the association of being awake and your sleep environment. You want your brain to be programmed. Every time I go into my bed, I'm only going to sleep, or I'm, you know, that's the only thing that's going to happen. So if Mr. Wong is going to bed at 12 midnight and he can't sleep and he feels like it's been a long time, he's counting sheep in his head, well, then what we're going to do is we're going to get up out of bed, go to a different room that's dimly lit, and then do something boring. So when I say do something boring, well, it can be things like reading the dictionary, doing a word search, you know, where they have all like a page filled with letters that have hidden words that you have to circle. And we recommend these types of activities because everything is on the page in front of you. You don't want to be watching television. I'll touch on that. I'll touch on why in a second. You don't want to be doing things like Sudoku or crossword puzzles, because those things are hard, okay? So Sudoku requires math, and we know that doing math induces wakefulness. So certainly it induces wakefulness in myself. And crossword puzzles, the problem with that is, well, if you do a crossword puzzle and you solve a bunch of, you know, questions, and you get stuck in one that you can't answer, you become frustrated, and frustration leads to wakefulness. And lastly, we don't recommend that you read a magazine or a book, because conceivably you're only going to keep books and magazines that you're interested in. And you know, a lot of folks that I see, you know, they've finished 400, 500-page books because they can't fall asleep. And so that's a no-go. Okay, so we want you to do something boring after you get out of bed, go to a different room, and every 15 minutes you're going to feel that wave of sleepiness, that head nodding feeling, and that is your cue to go back to bed and go to sleep again. So, you know, so these are the first two principles here. And what you want to do is you only want to use the bed for only words that start with S. Okay, so sleep and sexual activity, and nothing more, because once again, it's conditioning. So if you start using your bed as a place to do homework, or if you use your bed, you know, as a place to hang out with friends and chat, you know, your brain is going to expect, okay, every time I walk into the bedroom, I'm going to do those things and not sleep. Probably what's the most important next point here, okay, is waking up every single day at the same time. That's very, very important. And I'll go into more detail in a second, but your wake time and first exposure to sunlight, that is actually what sets your internal body clock or circadian rhythm. So that sets the beginning of the 24-hour cycle that, you know, tells you when you should be awake, when you should be hungry, and when you should be sleepy. So if you wake up daily at a different time, you're sort of giving yourself what we call social jet lag. You know, the classic example is a person from Monday to Friday, they have to work. So because they have to work, they have to get up a little bit earlier. So let's say Mr. Wong has to go to work at 9 and he wakes up at 7. Well, you know, then, and on Saturdays and Sundays, because he doesn't have to work, he'll sleep until, you know, 11 a.m. Then it's disastrous, right? Going from Sunday night to Monday, because that night, you know, he's going to have to wake up early and have curtailed sleep. And it takes 24 hours to get over 1 hour of jet lag or a change in wake time. That's how long it takes for your internal body clock to overcome that jet lag, whether it's social or from travel. So in that case, in that scenario, that example I gave you, Mr. Wong is giving himself a 4-hour social jet lag, right? Because on Sunday, he woke up at 11 and on Monday, he woke up at 7. So Mr. Wong might not have good sleep or normal sleep up until Friday night. And lastly, no daytime naps. You know, this is a very important thing, especially during COVID times, because, you know, there's less to do. Many of us are working from home, and as a result, there's more opportunity to just lie down and maybe fall asleep by accident. The brain does a wonderful job of counting how much time you've slept per 24-hour cycle of the day. And if you sleep during the daytime, that takes away from nighttime sleep, because the brain says, well, you know, I need 8 hours of sleep. And if I sleep from 2 to 4 p.m., then maybe that night, that evening, the brain says, well, you already got 2 hours. Why not just sleep for 6? So in order to consolidate good nighttime sleep, there can be no daytime naps. And there's very few instances where daytime naps can be beneficial. So, you know, if you are going to nap, and I don't recommend this, I recommend that you only nap for 20 minutes at the very most. If you nap for more than 20 minutes, there will be sleep inertia. Your brain will actually go from light sleep into deep sleep, and trying to wake up from deep sleep is very, very hard. You're going to feel cognitively slowed. You're not going to be able to remember things as quickly. You're not going to speak or formulate plans as quickly. And this is something that we see with all folks. So if you are going to nap, don't nap for more than 20 minutes, because if you wake up from deep sleep, which happens after maybe that first 20 minutes of napping, the brain waves that you have when you're in deep sleep are very slow. And for you to wake up from that slow brainwave state to have to go to a very quick brainwave state, like when you're awake, it's very hard. We can also, you know, teach patients to do what's called relaxation therapy. And, you know, there's different types. And, you know, if you speak to your therapist, you know, they might be able to help you out with this as well. But we're just trying to reduce the arousal that interferes with sleep. we're trying to reduce the factors that, you know, make you more wakeful once again. But like, these are more targeted therapies, more targeted relaxation things. So progressive muscle relaxation is one that's simple. So what you're going to do is you're going to go from from muscle group to muscle group, and you're going to, you know, tell yourself, I want to relax. You know, I don't want to put any strain on any of these muscles. And you focus on the body part, and you go, you know, from some people go from the tip of their toes to the top of their head, or vice versa. Autogenic training. So we tell folks to, you know, like squeeze their hands, flex certain muscles, and then compare how they feel when they're not flexing, right? When you're flexing, there's a lot of physical strain. There's a lot of like, you know, sweating, like of the skin. You compare that to when you're relaxed, which is more serene. So, you know, and things like meditation and using, you know, apps like Headspace and Calm. These are things that you can download on your phone and listen, and they do give you guided types of relaxation therapies, or even yoga can help. So sleep hygiene, and you know, this is something that we all might have heard about already. So to have good sleep, you must have good sleep hygiene. But just because you have good sleep hygiene doesn't mean that you'll have good sleep. So this is the prerequisite for having good sleep. So it's important that everyone has this, okay? So what you want to do is avoid smoking or using nicotine several hours before bed. You do not want to drink alcohol or caffeine several hours before bed, because they do have a tendency to stimulate folks. You want to exercise regularly, obviously, but not too close to bedtime. And I tell people, don't exercise 2 hours before your bedtime, because when you're exercising, your heart's pumping, your heart rate is higher. And that's a very hard state to sleep. When you're just before you go to sleep, all those factors tend to slow down. You want to keep your bedroom quiet, cool, and dark. You know, having an appropriate bed environment is very important. If you live in a place that's very, very loud and you know, the lights are all on, how are you going to sleep? That's just not going to happen, right? So this is where choosing a comfortable mattress, comfortable pillows, that's going to count. And, you know, as much as you can, keep a regular sleep schedule, meaning a regular wake time. So I referred to the circadian rhythm or internal body clock several times. This slide shows you some of those things that the internal body clock or circadian rhythm controls. So things like, you know, when you're going to use the washroom, you know, when you're the most alert, generally speaking at 10 a.m., you know, when you're most coordinated, when's your most fastest reaction time, when is your blood pressure highest, and you know, and you'll see that there are changes in all sorts of systems in the body that are actually controlled by your internal body clock. And that's why I want to talk a little bit about this right now. Now, melatonin is the neurohormone of darkness. So, you know, during the daytime, there's light, and light prevents your body from releasing melatonin. When the sun comes down, well, it starts to get dark, and there's actually receptors in your eyes that can detect this. And when it detects low light, you start releasing melatonin from the pineal gland of your brain. So that actually is, you know, the neurohormone that tells you when you should be sleepy, okay? So the problem with this is that, you know, with aging, melatonin secretion in the brain can be attenuated, meaning it doesn't go up as high as it should, and it doesn't induce sleepiness. In some folks, because of injury or inflammation, they can also have this problem with not releasing melatonin enough. And in some folks, naturally speaking, their melatonin secretion is going to be off cycle, meaning that when it's dark outside, the brain doesn't release melatonin for too long of a period later. So they don't feel sleepy until like late in the morning. So how do we combat that? You know, I've talked about this. This is just the things that circadian rhythm controls. How do we, you know, combat insomnia that's associated with your internal body clock being off kilter, or your body's not releasing enough of it? One very safe over-the-counter solution is taking melatonin. And the key here is, you know, the timing of when you take it. Because if you look on the bottle, it's going to say something like, take melatonin half an hour to an hour before your bedtime. And that is presuming that melatonin is something that actually puts you to sleep, like other types of sleeping pills. When we study it, we know that it has a 10% hypnotic effect, meaning there's only a 10% of the effect of melatonin makes you feel sleepy, but 90% of it is an internal body clock switcher. What it actually does 90% of the time is that it changes the onset of your sleepiness. It tells your internal body clock to say, you know, Mr. Wong, I want you to go to bed earlier, okay? So what you have to do is you have to take it 4 to 5 hours before your bedtime, okay? So not half an hour to an hour before your bedtime, but rather 4 to 5 hours. And that's how long it takes to go into your brain to tell your body to say, okay, I need to feel sleepy now. So if your insomnia might have something to do with your internal body clock not working properly, then you're going to take melatonin between 0.3 to 5 milligrams and 4 to 5 hours before your bedtime. And this is over the counter. Last little bit. So bright light therapy is also very good at making you feel sleepy at the correct time. And it also has been proven to be equally as effective as Prozac, which is an antidepressant medication in the treatment of depression. So, you know, I tell almost all my patients this: the moment you wake up in the morning, expose yourself to bright light. And the best bright light in the universe is our sun, at least for us on Earth. You just open your blinds, you expose yourself to sunlight. In the winters, like, you know, if it's dark out, you can consider getting a bright light machine. You just have to get one that's a minimum of 10,000 lux. Expose yourself for half an hour to an hour. And that has the effect of anchoring your internal body clock at the right time. And that's associated with the point I made earlier in the behavioral therapy part, which is you got to wake up every day at the same time. So waking up at the same time, allowing yourself to be exposed to some sort of bright light, anchors your internal body clock properly. And if all else fails, well, you can always ask your doctor to be referred to a sleep clinic where folks deal with sleep medicine. Thank you very much.
So, Dr. Mark, I have a few questions from the audience. I don't know if you can see, but I can read it out to you. The first person is Alan. He wants to know about the impact of the sleeping pills, that impact on the sleep quality.
So sleeping pills, most of the ones that you get prescribed by your family doctor, so things like Zopiclone or Zolpidem, the ones that start with Z, as well as the ones that that are sedating antidepressant medications, so things like Trazodone or Doxepin. These medications, and I want to include in that list Quetiapine or Seroquel. These are all medications that actually increase the proportion of light sleep and decrease the proportion of deep sleep. Okay, so it induces sedation, but that doesn't translate to the same quality of sleep you would get without the medication. Okay, so I guess the concise answer to that is sleeping pills make a person sleep, but you're going to get more light sleep versus deep sleep, which is another reason why maybe you should do behavioral therapies as opposed to medications.
Thank you so much. Another one is from Anne. Her question is that early birds versus night owls. So if the early birds sleep early, wake up early, is it better than the night owls in general?
So that's sort of a trick question. And the answer is there isn't one that's better than the other. People are just designed how they are by genetics, and we can't control that. Okay, if you come from a family of people that sleep early and wake up early, aka early birds or early morning larks, or you come from a family that has a tendency to sleep very late and wake up very late, those are called night owls, then that's who you are as a human being. The problem is society, and we can't change this. Okay, so here's what I'll tell you. If I wake up and I go to the bank, or if I wanted to go to the bank today, I have to be there between 9 to 3 or something like that. I don't know, right? Society is based on the concept that businesses and work is done when there's light outside, and it's closed when it gets dark, because you got to go home and deal with your family and cook and things like that. So here's the issue. There's not one that's better than the other, but it's more disadvantageous to be the night owl because your body clock doesn't lend itself to living in a society that obeys the command of light and dark, right? A person that sleeps late and wakes up late, they're probably going to have problems getting to work on time, getting to school on time, and as a result, their work or school performance is gonna deteriorate, right? And we see this most often with young people, because young people have a tendency all young people around the world have a tendency to sleep late and wake up late. And that's actually part of being a human being. Like, you know, when we're young, we tend to sleep late and wake up late. When we get older and older, we wake up earlier and earlier. So that's why you'll hear stories of grandparents that sleep at 10 o'clock and wake up at 4 a.m. You know, there's a natural shift to wake up earlier with time, but it's the people who are stuck sleeping late and waking up late. Those are the people that end up needing treatment.
Thank you. And we have a few more minutes, and I'm going to go through the questions that come in accordingly. So this one is a little lengthy. It's about like this person, so I don't have the name, but most of the time I don't have trouble falling asleep, but I usually sleep poorly, waking up frequently. I think I do so because I hardly go to sleep prepared to sleep well. I just crash because I'm too tired or whenever I try to do more things. As a result, I leave one light on and then planning to do some more and then get up, do some more things. So basically wake up and do many things. This is understood as insomnia. Do I only need to let things go and prepare to sleep at certain time? Another challenge is that I wake up irregularly. These days, no matter what time I start at night, I tend to wake up really early. These days I sleep late. I tend to easily sleep more than 7 hours and wake up different times. I wake up early, stay in bed, sleep some more, wake up later, want to go to bed. So a lot of irregular times.
So I have 2 tips for this person. So the first tip is you're going to follow what I mentioned in the slides, which is you're going to wake up every day at the same time, and you're not going to nap in the afternoons. You're not going to nap during the daytime whatsoever. That is going to consolidate all your sleep to nighttime. And then the second thing you're going to do is you are going to not have any lights on in your room. Okay. Even dim lights have been proven that they can pass through your eyelids and your eyes can see them. And it's the melanopsin receptors in the eyes that react to light that control melatonin secretion. You know, those are going to be the ones that get affected. And if you're not secreting melatonin correctly because there's some sort of light in your room, then you won't sleep well. So wake up every day at the same time. Don't nap during the daytime. Turn off all the lights.
Thank you. And this question has 3 parts of it. So my mother has insomnia, anxiety, and depressions for many years. Can she get better? She has to take medications and has many side effects.
So when people have depression, you know, one of the criteria that we know about is, you know, do they have problems sleeping? Some folks sleep too much. Some folks sleep too little. Classically speaking, people with depression sleep too little. They have a problem falling asleep. So a lot of the medications that treat depression will also help sleep. So one of the ones that pop up in my mind is mirtazapine or Remeron. You know, this is a medication that we study a lot, even here in Toronto, in fact. And you know, it helps sleep and mood. So, you know, this is a situation where you want to see if can you kill 2 birds with 1 stone? So, you know, maybe choosing a medication that will help you sleep, but also improve your mood and anxiety, right? So that's one of the ones I can think of. And the connection between insomnia, anxiety, and depression is bidirectional, meaning that if you have insomnia or depression, you know, it's probably going to affect your sleep. And if you have bad sleep, you're more likely to have depression or anxiety. You can follow these dictates of behavioral therapy for insomnia while you do your treatments for depression and anxiety. And it's actually been shown that behavioral therapy for insomnia, even though it only impacts the sleep dimension, improves mood and anxiety overall.
Thank you. I have these questions. Would you recommend melatonins for young people in their 20s who has ADHD?
They can absolutely take it in conjunction. You know, the medications that treat ADHD don't impact melatonin or vice versa. A lot of folks with ADHD have trouble sleeping, not just because, you know, by definition, you know, a lot of folks with ADHD, their minds are everywhere. They're hyper aroused, meaning that at their base natural state, they're like, you know, they're more aware of their surroundings and more things are going on in their head at the same time. Care needs to be taken if they're taking medications that treat ADHD, that it's not too close to bedtime, because a lot of medications that treat ADHD are stimulant type medications. And if you take it too close to your bedtime, you're not going to sleep.
Thank you. I have only like maybe 3 minutes. I'm gonna squeeze in a couple of shorter questions because a few more questions talk about you expend more time on the therapy, but which I don't think we have time. But this is something that I think is important, is that do we have sleeping tips for shift workers?
So I spent maybe 25% of my time when I see insomnia patients dealing with shift workers. So shift work by definition is not compatible with good sleep or good health for that matter. Shift workers have a much higher incidence of obesity, diabetes, and hypertension compared to the general public that work, 9 to 5 type hours. They also have, for whatever reason, a higher incidence of heart attacks and major coronary incidents at the early morning, like between 4 to 6 a.m. And they get into more car accidents. But we can't just quit jobs just like that, right? So how do I make my sleep the best it can, given the fact that I have to do shift work? So for you, it's going to be very important to make sure that you get the melatonin, okay? When you're working day shifts, working 9 to 5, and you're trying to go to sleep when it's dark out, you're going to take the melatonin 4 to 5 hours before bedtime. You're going to wake up every day at the same time for those daytime shifts. When you're doing overnight shifts, what you're going to do is at the beginning of the night, when you're starting your shift, you're going to do what's called the judicious use of caffeine. Okay. So meaning that you're going to maybe drink a little bit of coffee to be able to sustain your vitality and your ability to concentrate and perform during those, hours when you're usually sleeping, but now you're awake. So, generally speaking, people will feel very sleepy doing a night shift around, 3 to 4 a.m. Now, the key is when you go home, that period just before you go home. So, a person working a night shift, as they go home, the sun is coming up from the horizon, right? Some people wear these yellow sunglasses that block out blue wavelength light because we think that blue wavelength light, amongst all the wavelengths of light, is the one that affects the melatonin secretion that's going to make you feel sleepy when you go home and turn the lights off. So the yellow sunglasses is one thing, and it blocks that light. And the other thing is you're still going to take the melatonin 4 to 5 hours before your desired bedtime. So if you want to sleep at 11 a.m., you're going to want to take it at maybe 7 o'clock in the morning. Yeah.
Thank you so much. And I think, unfortunately, I cannot take any more questions because we have a lot more. With our team, we're trying to respond to all the questions that we have on the screen. At this time, our sessions will end with Dr. Michael Mark. Throughout the day today and up until 6 p.m. today, we're going to have very language specific workshops. Please, if you understand more any of that language, you can join our sessions with different topics. Thank you so much, and we will switch over to another workshop. Thank you so much, and have a wonderful the rest of the day.